Good afternoon, everyone, or good morning, depending on where you are. Welcome to today's AMCHP All-Member National MCH Policy Call Series / COVID-19 Town Hall. So glad you could join us. We have a good lineup. I will apologize in advance for any background noise, as I do have kindergarten going on in the other room, and quite conveniently music classes at 2:30, but hopefully it won't be too disruptive. So I see folks are still signing in, but I want to get us started, and we are recording. So let's jump right into it since we have all of our presenters. As usual, housekeeping questions. You can, if you have any technical difficulties, please contact Jess Cohen, jcohen@amchip.org. If you have any questions for the panelists or questions of other attendees, please make sure that when you type into the chat box, you click down and choose all panelists and attendees so that everyone can see the question. If you do just have like a technical question, feel free just to send it to the panelists or contact Jess directly. So to quickly review our agenda today, I'm gonna actually turn it over first to Dr. Warren so that he can introduce a guest speaker today from Vermont about their Medicaid waiver related to COVID, just due to time.
Assurances, like making sure you're meeting the 30-30-10 requirement, making sure the basic elements of your application and report are there so that we can get those funding awards out as soon as we are able to. Of course, that's all subject to congressional appropriations and what happens in terms of a budget or a continuing resolution. Also then, following October 1st, between then and the end of December, we'll be conducting the virtual block grant meetings. We've already started training the reviewers. We did a training for them last week. We've got a training for the family reviewers this week. And so a lot of work going into getting them prepped to be able to hear from you and provide you with technical assistance. And then we will be doing summary statements on a rolling basis after that. So that's an overview of the general timeline. I think you all have seen that before. If we could go to the next slide. That's more of the same. If you run into any questions or issues as you're submitting your block grant, please don't hesitate to reach out. I have been where you are, and I've been at the point where you hit the button and you think it's gone through, and then something happens with the system and your application disappears, or you're not sure if it's gone through, or you can't get something to work. The team is absolutely available and happy to help you if you have questions. So don't panic. We haven't lost one yet. We will figure that out for you and help you get what you need to make sure that you get your submission in. Next slide. We talked about the jurisdictional reviews a little bit in terms of when they were going to happen. This year, we'll focus on your 5-year needs assessments, what priority needs you selected, and how those align with your action plan, as well as the review of your financial and programmatic forms. We won't be doing the in-depth sort of MCHB topics of interest that we did last year. There's too much going on this year, and it's a needs assessment year, so we're going to let you focus on you this year. And we'll be doing a pre-review webinar for you all in a couple of weeks. Title V directors should have an Outlook invite that has the Zoom details. If you haven't gotten that, just reach out to your project officer and we can get that to you. Next slide.
Dr. Warren, I just want to mention there's a question to clarify that it's due by 11:59 Eastern time.
That is my understanding. I'm going to lean on my colleagues, Michelle Lawler or Ellen Volpe or Nora Carswell, any of them who are on who can clarify that. Anybody from DISH who's on? 11:59 Eastern. Yes, Michelle confirmed. Thank you. All right. Also remember that there's the opportunity to request TA. This is a really great resource. We set aside a decent amount of money every year to support states that have TA needs. So this can be anything related to your block grant action plan, your needs assessment, opportunities that you want to explore. The reviewers may bring up some items at the review meeting and provide some on-site technical assistance there, if you will. But also you may have items that you want to raise for technical assistance after your review. So over the course of the coming year, as you work to implement your plan. So please let your project officer know if you're interested in that, and they can point you in the direction of how to request that. And the next slide. Just a reminder about SSDI, we extended those application due dates. That's now September 22nd. And remember, you've got the opportunity to submit an abbreviated progress report this year if that would be helpful for you. And I think that is the last slide I have. Yep. Thank you so much. And thanks again to Monica and the great work going on in Vermont.
Thank you. All right. Well, I'm going to go ahead and give some legislative updates. Luckily, well, not luckily really, but in terms of preparation for the PowerPoint for today, this July 21st article still stands. Not looking good on virus aid discussions. There was a vote today in the Senate on what they're calling a skinny COVID package that was only supported by Senate Republicans, meaning they weren't able to get enough votes in order to pass it because you need 60 votes in the Senate to move legislation further. And it was a really scaled down version of aid to address COVID response. I think some of the Democratic leaders were calling it emaciated, not just skinny, much smaller than any of the other packages that have been proposed. And so it's just not looking great for further COVID relief. And I think what that means for us is just looking towards the normal CR process, or appropriations and continuing resolution process, and appropriations generally as the vehicle to move forward on our priorities. Because for, I'd say, the past 4 months, I mean, everyone who's doing advocacy work has been doing all of their letters and advocacy, whether it's their virtual Hill days or social media campaigns, were really centered around, okay, in the next COVID bill, we should include this. In the next COVID bill, we should include this. And now that it's looking more and more elusive, we really need to rethink our advocacy in terms of what are other moving vehicles, what are other opportunities to continue pressing forward with our priorities. So that's just something to keep in mind if you yourself are working on your own priorities to advance. Everything is going to be related to COVID. So, even when we're talking about normal appropriations for FY21, there's no more, aside from COVID. Like it has to be baked in because of the nature of all of our sectors, but of course, public health, having to pivot to address COVID. So I think that's going to have to be the next step in this process, because another COVID relief package, at least in the interim, things may change depending, of course, on how the election goes, if there's a change in the administration, if there's a change in the balance of power in the Senate or House. So on that note, at least the good news is there really seems to be a commitment to avoid the government shutting down. So by September 30th, of course, that's just 3 weeks away, not even. We do hope to see some sort of continuing resolution, but again, the conversations are all centered around making it clean. So no additional support for COVID response, but at least keeping all of the current programs funded at their current level. We know that's not enough, though, for responding to the health, education, and financial challenges posed by the pandemic. So our work will not end there, but at least things are looking good for avoiding a shutdown. With that uplifting update, I'm going to turn it over to Dr. Karen Remley from the National Center on Birth Defects and Developmental Disabilities. Thank you, Dr. Remley.
Thank you, Amy. Can you hear me okay?
We can.
Great. Well, thank you for that introduction, and thank you everyone for all you're doing for families in this hard time. And I'm glad to see so many people are online, which means everybody's well. which is so important. I want to let you know that Jennifer Nelson, who's the lead of our clinical considerations group, and the MCH unit lead, Jenna Beauregard, are also on. So if we have any other additional questions, as many know, I'm starting week 4. So if there's something more complex than I can provide, I ask them to join in. I want to provide updates on recent and upcoming response activities, including an MMWR that was just released, and also a newborn screening publication that is certainly not related to COVID, but since babies continue to be born and we continue to look for newborn screening, it may be of interest to all of you. We will be updating web information for parents and caregivers, including the general frequently asked questions related to children and COVID-19, as well as web pages that include COVID-19 in children and adolescents, keeping children healthy, and stopping the spread in children. These changes are being finalized and will be posted soon. And as you can imagine, with kids going back to school, we're observing and learning more every week, so they will continue to be updated. Additionally, there are 2 very relevant updates for guidance that are in clearance that hope to be live very soon that'll be of interest to all of you. An update on guidance for the lay audience on pregnancy, care of the newborn, and of the mother with COVID, if the mother has COVID-19, and breastfeeding. So the main changes will include really, which will make everyone in this audience, I think, happy, an emphasis that mothers with COVID are encouraged after discussion with their families and healthcare providers to room in with their newborns and breastfeed them while taking precautions. There'll be a lot of social media messages that will come out about these updates, and I encourage you to share those widely. We'll also have an update to guidance for healthcare professionals on the care of breastfeeding women to partner with that lay audience. The main updates reveal new evidence that mothers with COVID-19 are unlikely to transmit the virus to their children through breast milk, and that pasteurization of donor breast milk may inactivate the SARS-CoV-2 virus. So those there'll be recommendations there for infection control and prevention measures for lactation services. And then finally, there'll be updates to the guidance for healthcare providers on obstetric care during COVID that are being drafted. Those new guidance will replace the old inpatient obstetrical guidance and include both inpatient and outpatient considerations for women who are pregnant both with and without possible COVID infections. And then that MMWR, there was released earlier this afternoon, a delay or avoidance of medical care because of COVID-19 related concerns. As of June 30th, an estimated 41% of about 5,000 US adults that were surveyed reported having delayed or avoided medical care because of concerns about COVID-19, including 12% who report having avoided urgent or emergency care. And sadly, it demonstrated that was more common, the avoidance of urgent or emergency care was more common among unpaid caregivers for adults, people with 2 or more underlying medical conditions, Black adults, Hispanic adults, young adults, and people with disabilities. These findings are focused on adults, but we suspect there may be some similar experiences for the populations we serve. And I know all of you are continuing to advocate for the importance of well-child visits and for immunizations and medical care of children and youth with special care needs. We have, I think, Amy, am I correct, we have a slide about the upcoming COCA calls and partner calls, because there are quite a few that you may be interested in. There are 2 COCA calls next week, one on September 15th from 2 to 3 on telehealth and health equity considerations for addressing health disparities during the COVID pandemic. September 7th from 2 to 3, testing and treatment of the 2020-2021 seasonal influenza during the COVID pandemic. And you can get those details if you go to the website, https://emergency.cdc.gov/COCA/. There's also a partner call on Monday that you might want to join. It is specifically a COVID partner update about women, caregiving, and COVID-19. A delicate balancing act, and as evidenced, I think, all the time on these calls, all of you are also balancing that. There will be comments about the extra challenges that COVID poses for the physical and mental health for 2 out of 3 women who are caregivers to children, another adult, or people with chronic diseases, and that's next Monday from 3 to 4. And then lastly, also published this afternoon, was a paper on newborn screening. About 12,900 U.S. infants are predicted to be identified each year through our newborn screening. With one of the included disorders, newborn screening identifies infants at risk, as you know, for congenital disorders in which early intervention has been shown to improve outcomes. Hearing loss, hypothyroidism, sickle cell disease, and cystic fibrosis are the top 4 in terms of the most common disorders, but there are many others that have significant impact on children's health and well-being. And we are working very closely to really think about health equity and the impact of newborn screening. It is an incredible public health success story to talk about how we do universal newborn screening of all babies, regardless of where they're born in this country. But we know that once those babies are born and identified, their ability to access care and to be able to have the recommended care throughout the life course is different, not only for different groups within our country, both racial and ethnic groups, but also for different diseases. So here at the center, we're particularly going to start focusing on what our data and our epidemiological data can help identify and explain those gaps and be able to help educate those that do research and those that provide clinical care to help to eliminate those gaps that lead to health equity. And Amy, I will turn it back over to you and see if anyone has any questions. Thank you.
Great, thanks. There was a question if the links could be shared in the chat for sign up. Could I ask if maybe Wendy or Sasha might be able to just paste those in the chat in the meantime, because I can't copy and paste them from the slide in the Zoom, so thank you. And then there's a question, Dr. Remley, if you could share a link or a source for the NBS paper, the newborn screening.
And that comes out this afternoon, and that's in the MMWR. And so I'd ask, I bet Wendy can give that link too. So we'll give you the links to that paper in addition. And I really encourage everybody to think about, and maybe not today, in the interest of time, but any ideas or thoughts or best practices in your state around really making sure that newborn screening for all newborns occurs, I would be very interested in hearing if you've got best practices.
And I think it's so relevant to some of the work that we're doing right now with some of our HRSA funding on improving telehealth services for MCH right now, because one of the focus areas is around newborn screening. And so while I don't have that much information to share yet about what some of our states are looking to do in that area, we will at some point as we get through our new project. And so I welcome if Brittany or Sabra, have anything to add on that topic, please feel free to chime in. But thank you, it's very timely. And I see.
Yeah, I'd love to be able to say that we do universal screening, but then we also then do universal early intervention.
Yes.
And that's when we'll be successful. Thank you.
Thank you. Does anyone have any questions at this time for Dr. Remley while we have her? And of course, feel free to keep typing them in, or, well, I was going to stop now for Q&A in general anyway. We have a lighter itinerary today, so the next few items are just some heads up about upcoming AMCHP hosted events and opportunities. The first is on Wednesday, October 7th. We will be having a webinar about ACA open enrollment season hosted by AMCHP's own Thea Chaudhry, and she will be joined by speakers from Enroll Virginia and from Families USA, who are doing fabulous work on outreach and enrollment. And I'm curious to see how this year the landscape for that will be different, given how many people have experienced a change in their health coverage and options, and quite frankly, eligibility due to income changes this year. So please join us on October 7th for that. Next, sorry, I have a visitor. Bree, do you want to share some information about the new emergency preparedness ALC?
Thanks, Amy. Thanks, Amy, and hello, everyone. I just wanted to let you all know that we are currently recruiting for our third cohort of the Emergency Preparedness and Response Action Learning Collaborative, or EPRALC. And this is a technical assistance project supported by CDC Division of Reproductive Health. The goal is to ensure that women and infants are in our states and territories are included, their needs are included in the preparedness and response efforts at the state territory level. If you would like to learn more about our project and apply, you can use the links on the screen, and they were also sent out in the slides. And the deadline for application submissions is September 18th at 11:59 Eastern. So if you have any questions or would like more information, please feel free to email me at blewis@amchip.org.
Awesome. Thank you, Brianna. And then next, oops, sorry, did I do that or did you, Bri? I'm going to invite Paige to give a heads up. Let's put the slideshow back. Okay, Paige, would you like to give everyone a heads up on this?
Absolutely. Hi, everybody. So this is more or less just an announcement to keep everyone in the loop, as I know many of us are just trying to avoid duplication of efforts in these trying times when things are changing every day. So I'm thrilled to share with everyone about an initiative that AMCHP will be kickstarting in the coming weeks. This is in collaboration with Child Trends, and it's through funding through the CDC. So this work is focused on bringing together those that are most impacted by school closures, school reopenings, vice versa. And specifically, we're looking at this through the lens of children with special healthcare needs, and then those students with disabilities and their families and educators. So bringing those groups to the table alongside community members to really make the best informed decisions. I just saw that someone said, hard to hear me. Sorry about that. I'll speak a little bit louder. So again, this work is focused on bringing together those who are most impacted by school closures and reopenings, specifically children with special healthcare needs and those with disabilities. So I put the objective of the work here on the screen for everybody, and really the heads up is for all of our partners and everyone who's on the call, but mostly to our Title V leaders who are here. If you have any best practices on how you may have been involved and maybe gotten a seat at the table with education officials, we'd love to hear about how that opportunity went, what conversations were had, and so we'll be reaching out to you all in Title V programs to weigh in as we create a set of principles to inform this work. So again, really looking at grounding this in the experience of families, students, and educators, and looking at how we're ingraining public health principles and health equity. So any questions, you can reach out to me. I'll put my email in the chat box. Thanks, Amy.
Awesome, thank you, Paige. So looking forward to continuing our work in this area too. So our next call will be in 2 weeks on September 24th. To give you a little preview, we will have a presentation to follow up on a topic that started to come up on the last call regarding the teen pregnancy and what we are seeing during this past few months period. So thank you in advance to our members from California who will be presenting on that. We are also looking into covering some information around vision care. It's not confirmed yet, but we'll keep you posted. But that is another topic area that we thought would be helpful to just share some ideas around and some opportunities for collaboration on the state level with folks in the community promoting vision health, and following up on some discussions we've had before on promoting well child visits. I mean, vision screenings are another, and not being in person in school, right? Those are like the two places that children are most likely to receive their vision screening. So we want to talk about strategies to get those rates up as well. So that's all we have today. So happy to leave it open for another minute or two if there's any questions for any of our panelists, or if there's anything you want to share, or to offer up other topics you'd like us to discuss further. But that was the end of our agenda today. And so hopefully it was helpful, and music class is just about starting, so I'm going to mute myself.
Amy, this is Karen Rimley, and I just want to say, as somebody who's a mother of adult children, how much all of you who are professionals who are balancing your own children, taking care of other mothers and children, and doing the work you're doing every day, it has to be just unbelievably mentally and emotionally exhausting. And so I just want to thank each one of you on the call, and the men who are doing the same thing too, because there are a lot of stay-at-home dads who are doing all that juggling right now too. I just can't imagine being of childbearing age, having children at home, and what you're all going through. So just know that we all applaud you and have your back.
Thank you. And I just want to echo that for everyone else on the call dealing with that as well. I was joking with somebody about dealing with meltdowns and clarifying that, you know, meltdowns are not just for children anymore in this period. So, but we're all getting through this together. And yeah, I just want to really echo what Dr. Rumley is saying about all the work that you as our members are doing to make sure that we are supporting families, and especially those who had been left out of the conversations before, and making sure that they're part of the conversations moving forward. So if there's no other questions at this time, thank you again to all of our wonderful panelists, to all of our participants, and we will see you in 2 weeks.